but there should be
Yeah.
plenty.
And I've just started recording it as well, because if yeah, like Safrata's on the bus, she might lose connection. So okay.
Okay, brilliant. Okay, so what is PBL? Who can anyone remember what it is? Problem-based learning, sorry, I should say, otherwise known as PBL. Can anyone remember?
Come on, let's have some unmuting. Faisal, I'm going to pick on you because you contributed last week. Yeah, go on then.
It's basically group work where you're giving a case study and you need to work with your group to form your own learning objectives and basically work through the case.
Absolutely. That's quite a nice way of describing it. So yeah, it's all about group work. So as you say, it's working in a team. You develop your own learning objectives through discussion of the problem. So whether that is a case study, a scenario, some data, some research, it can be a variety of different things. The difference between this and something like maybe like lectures is that students are much more active. It's what's known as active learning. So the idea is you kind of think and develop your own kind of learning, your own thoughts. You're solving different sorts of problems. Using all sorts of thinking strategies. You will develop all these skills that I've listed on the screen. So it's got problem-solving skills, self-directed learning, flexible knowledge, things like that. This is something, just to remind you, this is something that not every medical school will do. Some universities will do it a little bit, others, like ourselves, for our medicine degrees, we do a lot of problem-based learning throughout the 5 years. So it's really important just to think about whether this is something that will suit you as a learner, as kind of a potential medical student. Lots of students really like it because it is active. You're discussing problems, you're learning all these different sorts of skills. And remember, these are the sorts of skills that you will be needed. You're sort of needed to have if you go on and have a career in medicine. So this is something that we think gets you really quite well prepared for becoming a doctor. Okay, what skills and attributes do you need? Obviously, teamwork's one of them. What other? Can you remember other ones that we might have mentioned last week?
Listening skills.
Absolutely. Absolutely crucial. You need to be able to listen to all the different members of the group. Any other skills?
Problem-solving skills.
Absolutely. It's all about dealing with all sorts of problems. So you're going to need those sorts of skills. Again, they're the sorts of things that you will develop and get more confident as you progress. The more PBLs you do, the more practice you get. All these sorts of skills, there might be an aspect of these sorts of skills that you're not so good at, but through practice you will improve. So just kind of bear that in mind. Not everyone will start. Actually, no one, I don't think, starts these PBLs kind of with all the skills that they need. Okay, so there's lots more skills as well, but these are just some of them. So some of them we've mentioned already. So the communication skills, absolutely vital, as well as listening, note taking. I think another thing that's really important is also respect for other people's views. So lots of people have all sorts of different views. So it's being able to have respect for those different views, those opinions, and being able to take those on board when kind of coming to your own opinions and your own conclusions. And it's a really good way as well as developing your presentation skills. Okay, so how does it work? Again, he described it a little bit at the start. Would anyone else like to add any more about how it works?
Is there like 4 roles assigned to each person?
Well remembered. There's different roles. We're going to cover that with the next slide. So there's different roles. Okay, I'll just whiz through it before we go on to discussions. So you do, as you mentioned earlier, get presented with a problem, a case study, depending on kind of what you're studying. It could be pretty much anything to do with medicine, but it's normally linked in with what you are studying at that time. So whether that's in your lectures, any other sorts of teaching, or the clinical placements that you might be on. So it will just kind of enhance the teaching that you're taking part in, the learning of whatever it is at that time. So it could be, for example, you could be learning all about the cardiovascular system and you have a problem linked to the cardiovascular system. So it just kind of enhances what you are learning at that time. And as we said previously, you come up with your own learning objectives based on the cues in the scenarios that you're presented with. So it's a lot more active than just going to sit in lectures, which also have their uses. So you talk through the problem, you would then brainstorm all sorts of hypotheses, solutions to the problem, decide what you need to learn, what you need to go away and research. So this is what's called learning objectives. And you go away and research them with the idea that you will be able to solve and address the problem that you have been given. And you would go away and do that kind of research in your own time. So whether that is like reading books in the library, whether it's researching online, which of course is probably what would happen in most cases these days. And then you come back and then you present your findings to the group and then the facilitator. And there are some what's called formative assessment at the end of the follow-up session. So students will be given some short answer questions. I've got some for you later on, just to assess them on what they have been researching and what they've learned. So these are the sorts of things that won't count to their final grades, but it just helps them with their learning and understanding how well they've kind of learnt a topic, how well they're doing. And then some of the problems, questions, topics may appear on the end of year exams with everything else that they've covered. Okay, so now it's all about the group roles. Okay, so you remember that there's 4 different roles. Can anyone remember what the roles were? Okay, I'll go through them. So there are 4 different roles. So the tutor is the the academic tutor from the university and every PBL group will have one. They kind of make sure that the group stays to task, everyone participates, make sure that students have understood the problem, assessing their performance. And then the other 3 roles that you can see on the screen will link to the individual members of the group. So there's always one scribe. So that is the person that will record all the points that have been made by the group It will help the group order their thoughts. They will, of course, have to participate in the discussion as well. And again, they can also record resources that are used by the group. Every group will have a chair. So that is the person who will lead the group through the process, encourages all the members to participate, helps the group dynamics, keeps everyone to time and on task. Make sure that the scribe is doing their job, so to speak. And then everyone else will be a group member. So they will kind of following the steps of the process, participating in a discussion, listening to others, asking open questions, playing an active role in the group. So that's an overview of the roles. So, and students will get the opportunity and be expected to take turns at being a scribe and chair and a group member. So it's not a case of people don't like leading, they won't ever do it. Everyone gets a turn. So they're used to being the chair, the scribe, the group members. Because again, that's something that helps with the skills that students are developing and the experience that will help them become fantastic doctors when they graduate. Okay, so just to recap, we had a scenario last week, which is all about nutritional problems. And these were the steps that we took. And these are the steps that students would take in a real PBL, as so to speak. So to begin with, students would identify and clarify any unfamiliar terms that might be presented. And then the scribe will make a note of any that are unexplained after the discussion so that these can be clarified in their own time. Step 2, read the scenario, define the problem, or it could be several problems to be discussed. This is a sort of thing where, depending on the scenario, some students will have different views on the issues. Everyone should be considered, and then the scribe would record all the list of the agreed problems. So after that, there is a brainstorming session to discuss the problems, suggesting possible explanations on the basis of prior knowledge. Group members will draw on other people's knowledge. They will identify areas that they perhaps don't know anything about or only know part about and need to find out more. Again, scribe will record all the discussions that are taking place. And then after that, students will review the steps 2 and 3, arrange the explanation into some solutions, and then the scribe will organize these and restructure if necessarily. And then before the end of that PBL, they would formulate their own learning objectives. And there would have to be a consensus on what the learning objectives should be. So they should be focused, achievable, comprehensive, and appropriate for that scenario. So after all of this, students would then go on and do their own research. And then they'd come back, and then we would do steps 6 and 7, which is what we are going to do today. So after the last session, I asked that you go away and do a little bit of private study. You didn't have to do very much. In a typical PBL at medical school, all the students would have to gather information to relate it to each of the learning objectives. So just to let you know. And then the final step would be sharing the results of the private study. And then the tutor would check the learning and assess the group. So now we're just going to have a short discussion on what you researched in relation to the learning objectives that I gave for you for last time. And these related to a scenario.
So we can ask for a volunteer, Alistair, to go first. I think we've definitely, I think we've only got 2 of you in the group that possibly here last week anyway. But yeah, so
has everyone read the scenario? The people that weren't, because I could pop that up on screen for a little bit.
yeah, go on. Yeah, put that up. Yeah, for Gabby and Andrea.
Okay, so I've just stopped presenting. So if you just bear with me, I will put the scenario up.
Yeah, Gabby and Andrea, you might already be very knowledgeable about it, and you can contribute from what you know.
Okay, fantastic. Found it. Actually, it should refresh everyone's memory.
Yeah, I mean, we can
Okay.
have it up whilst the two are feeding back as well. So, I mean, Fazer, do you want to go first? So I'll keep picking on you.
Sure. Defining obesity as the first point, a medical condition in which excess body fat has accumulated to an extent that it may have a negative effect on health. And how it is diagnosed is that, well, your body mass index is assessed, and if it's above 30, then you're diagnosed as obese.
Absolutely. Well done. Anything else that anyone else might like to add?
I
Okay, so
only did the last question.
okay, no, I was just referring to that first question. So we'll cover a different question. Okay. So we'll cover each question as we go through. So just one other thing to note. So that was perfect for the obesity and how it's diagnosed. Something else you could have said about in terms of diagnosis is you doctors could also look at the waist size as well as BMI, because something else to just be aware of is people that are very muscular can have high BMI but without much fat. So that's just something that students would have had to have, if they were in medical school, would have had to have been aware of. But yeah, everything else absolutely perfect. And hopefully, I've just moved the screen down, so hopefully everyone has a chance to, if you haven't read it already, read the learning objectives. Okay, so that's one learning objective. That's one that is relatively straightforward. As you'll see from some of the other questions, there might be a bit more in discussion or things to consider. But normally with the sort of defining something, they're relatively straightforward. If there's multiple definitions, again, this is something that students would have to be aware of. Okay, so moving on to the second learning objective. So hopefully everyone's had a look at that scenario. So I am just going to swap over back to the presentation just so we can all see what the learning objectives are. Okay, so has anyone looked at the long-term consequences of obesity?
I have.
Fantastic.
The long-term consequences of obesity that I found were stroke, diabetes, hypertension, heart disease, digestive disorders, and sleep disorders. I think sleep disorders might be the case with Shahina, who has trouble breathing when she's sleeping.
Brilliant. Yes. Excellent. Excellent. They're all long-term consequences of obesity. Absolutely. So yeah, that's perfect. And again, these just to remind you, these learning objectives will be, there's normally, the number of them can change depending on the sort of problem that the students are having to solve, but hopefully this will give you a good idea of the range. So yeah, absolutely, those are some examples of the long-term consequences of obesity. Something else to mention as well in there is also, it can also affect the quality of life for someone and kind of lead to psychological problems such as depression and low self-esteem. And with these answers, medical students will have probably drawn on a variety of resources to get these answers. So typically there might be a little bit more of a discussion if because normally you'd have about 8 people in the group, so there's maybe some things that people have found that others haven't, that kind of thing. So it's not a case of they're all kind of short answers. There'd probably be a little bit more discussion involved. Okay, so moving on. So describe the elements of a healthy diet in childhood and discuss this in relation to Shahina's diet. So what did you find out in relation to this?
I found that for a healthy diet for a child should consist of 5 a days with fruits and vegetables, and their meals should be based on starchy food like potatoes, bread, pasta, and rice. And they should also include some milk and dairy products as well, but not as much as Shahina's.
Yeah, absolutely. So the sorts of things there, as you again hit the nail on the head, the sorts of things there you're looking at the healthy diet. So it's the 5 a day, kind of a healthy, balanced diet, healthy food from each food group, so they get a wide range of nutrients that help help Shahina to stay healthy. So again, this is the sort of thing that medical students would do. They'd probably have a little look in a bit more detail about the different food groups, sorts of along the lines of the things that you spoke about. See, well, you've done a little bit of that, talking about like starchy foods. So again, so the students obviously have a good idea of what a healthy, balanced diet look like. So it's balanced between the types of foods groups that they are using. Another thing as well to consider is this also will depend on how old a child is, because the appetites for children can vary depending on their age, growth spurts, how active the child is. So a child that is very, very active will need to eat more than a child that isn't perhaps so active. The child that isn't active, if they eat lots and lots of food, like for example in Shahina's case, they're more likely to put on weight because they're not burning off that weight. So absolutely. So you're talking about all the right sorts of things, having that balanced diet, being mindful of their age, growth spurts, things like that. Timing of the day for eating, drinking certain things as well. Some some children may be fussy eaters. So what sort of things could someone consider if they're fussy eaters? And then after that, you're talking, as you alluded to when you're talking about Shahina's diet, you would then look at her diet in terms of the sorts that she eats. It's not very balanced at all. There's lots of sugar, lots of salt, lots of convenience food in there. So all, you know, it's not very balanced at all. I don't think there was any fruit or veg. You know, full cream milk. You know, having not a great thing to do. So you be looking at what the healthy diet is and then explaining what might be the issue with Shahina's diet. Anyone got any other points they'd like to make or any questions at this stage?
Can always, obviously, don't forget you can put things in the chat if you haven't got a microphone.
Oh yeah, absolutely. Okay, so next question. So as you can see, the previous sort of questions are about the problem, the issues, and then this next one is talking about actually what should be done in the case of Shahina. So what would be the most appropriate management for Shahina? What sort of things could you say?
I said maybe replace her current diet with healthy meals and child-sized portions. I can see that she drinks a lot of mango juice. Maybe instead of mango juice, she could replace that with a fruit or water instead as a drink. Also, her parents could encourage her to exercise by rewarding her with rewards like when she does physical activities.
Yeah, absolutely. Thank you. Yeah, really good answers there. So I think the key there is well-balanced diet with some exercise, and also it's really good that you mentioned families are an important source of support for people in the sort of same position as Shahina. And normally it's the sort of thing where, you know, if a whole family starts to adopt a more healthy lifestyle, more healthy behaviors, do a bit more exercise, then it will support that person in the family that needs to do it. So it's really good that you also referenced that. You also gave a suggestion that rewards could be used to help as well. So again, some really good answers there. So absolutely, that's the sort of thing that you kind of be looking for, especially as in that problem-based scenario, the parents were wanting like medication to help this. So in the first instance with this sort of problem, it would be all about like making those lifestyle choices for the healthy diet, the exercise, that kind of thing before any medication. There is some medication out there, but that is called Orlistat, and it works by reducing the amount of fat that a person absorbs during digestion. So this is something that might not be suitable for everyone, but might be used in a sort of, you know, last chance, or if they're having issues, they're doing all the lifestyle changes, but it's not quite working. This may be something. And again, so medical students would have looked in more detail about that drug. They'd probably also have a look at what that drug does. The sort of side effect would be used in the case of Shahina, that kind of thing. Okay, so good. So why can obesity lead to diabetes mellitus?
From
Does
what
anyone know that?
From what I found, it's that hormones, glucose, and other substances in your body are involved in the development of insulin resistance. And in an obese individual, the amount of these hormones and glucose and other substances are increased. So the insulin resistance is also increased. And eventually this leads to your body cells resisting insulin, which leads to diabetes.
Perfect. Yeah, absolutely. Yep. Yeah, absolutely. Don't have I don't have anything else to add to that. So yeah, that's quite well quite a good answer. Thank you. But yeah, again, so that's something that's again the medical students would have gone away and researched. So again, you can see the different types of learning objectives that are dealing with different aspects of the problem. Okay. And then the final question, so what is type 1 diabetes and how does it differ from type 2 diabetes? And I know we had another student that had researched that who kind of mentioned it at the start. What did you find? Sorry, I can't remember your name.
It's Doha. So type 1 diabetes is when the body doesn't produce insulin and the person relies on insulin injections to survive. And it differs from type 2 diabetes because the person produces insulin, but the body doesn't know how to use it effectively. And it's either because they don't make enough or their cells are resistant to the insulin they do make.
Absolutely. Anything else that anyone else would like to add to that? Okay, just I've got a couple of other points to add. So type 1 diabetes is often diagnosed in childhood, whereas type 2 is usually diagnosed in over 30-year-olds. And again, you talked about kind of the treatments and some of the differences, so that's great. Okay, and again, in a PBL, the students will have probably looked in a lot more kind of greater depth about in terms of the details they would have researched, probably from different kind of journals, books, probably looked on the internet as well. And then again, they'd have a discussion, and then the scribe will be writing notes about what they found. Okay, so thank you very much for those responses. So it was nice to see that you have done your research. So hopefully that's kind of given you a little bit of an idea about how a PBL would work. So kind of in terms of the kind of going away, doing a little bit of research related to these learning objectives, and then having a little bit of discussion. I realised that there's only a small amount of people here. You're in year 12 as opposed to being in medical school. So like I said, the sort of discussions in the actual kind of PBL, it would be between 8 people. And obviously if 8 people have all done quite a bit of research, there's quite a lot to talk about. But like I say, hopefully this has kind of given you a little bit of an idea about how it kind of works. Okay. Does anyone have any questions at this point?
All quiet. I think we might trigger some questions at the end.
Cool. Okay, so just sort of one final little bit on PBL. So here's some examples. Like I said before, students will get short answer questions at the end of every PBL follow-up session that will kind of assess their knowledge. So I've just got 4 for you, just to kind of give you an example of some. So obesity is diagnosed by body mass index measurement. So what is the equation used to calculate BMI? Does anyone know that?
I'm not really sure, but is it weight divided by height squared?
It's height in meters squared, so equals weight divided by height meters squared. Wait a minute. So I've read that wrong. I've got the answer written down here. Wait a minute. So BMI is calculated from the weight in kilograms divided by the height in meters squared, which will equal the weight in kilograms divided by the height in meters squared. I should have put it up on the screen actually instead of writing it. And name 2 long-term consequences of obesity.
Diabetes.
Can
Depression.
be. Depression, yeah. Okay, absolutely. Yeah, that could have been 2. Excellent. Oh, sorry. Other examples that other things that you could have said. So it could something called polycystic ovary disease, hirsutism, and then musculoskeletal problems, and obviously you mentioned psychological problems as well. Okay, so there's just some other ones in there. So what hormone is responsible for controlling the amount of glucose in the blood? And you mentioned that previously. Yeah, perfect. And there are 2 basic reasons why this hormone doesn't control blood glucose levels in patients with type 2 diabetes. Name the 2 reasons. I think these were mentioned.
Is one of the reasons that body develops resistance?
Yep. Yep. And the other one, so we've got insulin resistance.
The body doesn't know how to use the insulin.
Yeah, so it's kind of it's an insulin deficiency. So not enough insulin is produced to maintain a normal blood glucose level. Okay, so that's a short answer question. So well done for answering those. You're pretty quick off the both of you pretty quick off the mark. That was good to see. Okay, so there's a little bit of time now. So have you before we finish? So I just wanted to give you the opportunity to ask me any questions that you might have about PBL, studying medicine at university, the application process, admissions, things like that. So does anyone have any questions?
Once you've discussed this in a group at university, would you then present it in front of a class or in front of a teacher?
You would be. Let me just unshare that. Okay, yeah, you would. It's just within your group, so it wouldn't be to a wider class or anything like that. So you would just discuss it amongst your group, and then the there would be a tutor, like I said, that would there's a tutor that would be kind of assessing you and kind of helping you with it if you've missed anything out. Okay, any other questions? So anything about PBL, or it could be, if you've got any other questions about university or applications, now's a good time to ask me.
How often are there PBL sessions, and is there like a session just focused on PBL, or is it part of another lesson?
It would just they run every week throughout the year. Not necessarily, sorry, I say every week. There might be times of the year when they're not running, but they're pretty much something that happens throughout the year. It's pretty consistent in our teaching. Students will take part in a module at the start of medical school. The name of it typically is fundamentals. That's it, fundamentals of medicine, I believe is the name. So that is it's something that students will do in the first part of the first sort of term of medical school. So it will go through all these different skills, all these different things that students need to be aware of. So there is a little bit of kind of preparation information about PBLs before they actually do a PBL. And of course, there's a lot of resources that will be online, a lot of support as well for students. And like I say, we don't expect students to come in and be able to do this expertly, straight away.
Can I just ask a quick question, Alistair, which hopefully will be useful for the students. But so obviously when students are thinking about kind of what medical school to apply for, how would you sell Queen Mary to the students? What does Queen Mary, what are your highlights, do you think, as a medicine student?
That's a good question.
What do they, I mean, I suppose, I
always find these questions really hard to answer. But no, we're really really friendly. It's a really friendly medical school, and that's certainly one thing where I would do a lot of work with, we have a lot of works with student ambassadors, so current students that work with me on all the different sort of programs and work that I do. And yeah, one thing that they say is the support, the camaraderie, the friend of the student, of the academic, fantastic kind of support. Fantastic students union. There's lots of societies and clubs to get involved. So that has been the sort of big thing that I think that keeps coming up when I hear this sort of question answered by students. So I kind of would echo that. I think also as well, being based in the East End of London as well is a massive advantage. So not only are we based in London, but in the East End of London, it's incredibly diverse. As a medical student, you will see all sorts of patients. There's you'll go on placements in the Barts, to other hospitals in the Barts Health Trust. So it's not just kind of St Bartholomew's at West Smithfields or the Royal London at Whitechapel. It's out towards out in like Southend, Homerton. There's some other ones that are just complete Newham. That's it. There's a few others as well. So you get to really see and experience a range of medicine, a range of kind of patients that you're not going to get at other medical schools in London, but also in the rest of the country. So I think certainly that's another thing that students say is they're seeing all these different sorts of patients, all these different sorts of scenarios that they might not get elsewhere.
Excellent answer. So yeah, students, so this is your chance to ask any other questions about the application process, about how you can prepare, anything at all. So Yeah, put it in the chat if you want to, or just unmute.
If I apply for like Queen Mary, what's the percentage of actually getting in? Like,
Good question. It's so I think it is. It's sort of, I'm trying to remember what this year's stats are. We have like with it's pretty much like 10. It's sort of 10 to 1. We get 10 sort of applications for every space. The Medical Schools Council's studying medicine pages, they have information, and they've got an entry requirements page that lists all the medical schools, their entry requirements, and so again, it's something to think about. Like you could apply into the places that have lower entry. But what I would say is, what I would say is, if you do everything that you're volunteering, that you do online instead, perhaps an online work experience, just don't. But then you have a really good understanding of medicine. You stand a really good chance of getting in. But again, if you look on the Medical Schools Council website, they will show you. Perfect. Thanks for putting that in.
So Andrew's just asked, what's the employment rate of medical students after university?
A good question. No one's ever asked me that. I don't know, but I think those stats are on our website, but it's going to be very, very high. It's going to be high because you are medical students. It's a kind of vocational subject. It's a subject that leads into a career. So the majority of our students will go on to their foundation years training, their foundation years 1 and 2, and onto their further training. So I mean, I've never been asked that question, but I don't know the answer, but it's going to be high because you're going to be studying medicine.
Yeah, I'd imagine. Yeah, it'd be very few that are out of a job.
Yeah. So any sort of career, any careers like in medicine, dentistry, healthcare, they normally have pretty high employment rates for the students that have finished those courses, because it's linking into a job, and we need doctors, healthcare professionals, aren't we? Always. Any more questions?
For Queen Mary. Oh,
sorry, you can go to her.
Okay. For Queen Mary, if I do like 4 A levels, what's the levels required for medicine?
So you would need to get, for our entry requirements, you need to get an A star, A level. So that's what we'd be looking for. And then in terms of your other A level, I think, we need that. And then whatever your other A level will just add on to your UCAS tariff, your points. Although, like, if you do take 4 A level, we will, in most cases, I think what will happen is we'd expect you to finish those 4 A levels. So it can help you it can certainly help you get more sort of tariff points, but just be aware that we would expect you to actually finish those, that 4th A level. Does that answer your question?
Yeah, thank you.
Yeah, on that medical schools website, you can literally go into every university and it will break it down, exactly what qualifications you need and everything, and the GCSE requirement as well, because that's what you only ever want to put 4 choices down that you don't want to be waste a choice basically. So So I've got, I've got Queen Mary's here, and it says you need 3 7s and 3 6s in any order. To include biology, chemistry, English language, and maths. So but other universities will have different requirements for that. So I think we're kind of 3 minutes from time. So I'm gonna.
Was there one more question?
Oh, sorry.
Can I ask one final question?
Yeah.
What would you say is the best way to prepare for a medicine interview at Queen Mary?
Good question. So the best thing to do is basically go think about why you want to study, why you're applying, why you're applying Queen Mary. What is it about the course? What is it about the location? But then we want to know about understanding about the realities of the profession. It's hard. It is fantastic as well. What are the benefits? What's the kind of harder side of things? And also we want to know about your the skills, the sorts of skills and attributes that we're looking for. What you would look for in your doctor when you go to the doctor is what we're looking for in our students. So basically, for that you would read any kind of work experience, volunteering that you might have done, any research, any wider readings, so you can answer a wide variety of questions. So that's what we're looking for from our students. There's information on our website about our interview process. There's also the Medical Schools Council has a lot of information about preparing for interviews, but that's essentially what we're looking for.
Yeah, you're breaking up there, Alistair. I mean, I sat in on Queen Mary. Sorry.
When you're thinking about, sorry, did I cut out?
Yeah, you keep breaking up.
Okay, sorry, no, sorry. What were you? Sorry, I interrupted you.
So I was just going to say, I sat in on, I had a really interesting day once. I sat in on Queen Mary medicine interviews as part of, I can't remember, some outreach thing. And it was really, I was really surprised really at how, how nice everyone was. But also just kind of, I think there was one in particular student that really sprang to mind. She did an EPQ on some medically related topic, and basically that took over the entire interview because the person that was interviewing was so interested in what this girl had done for her EPQ. It was just a really interesting day, and it wasn't that any of the questions were hard, but the students that were that did really well were the ones that they just gave so many examples, and you could tell they weren't just doing activities to tick them off. They could really reflect on everything they'd done. So I think obviously the more things that you do, you've got more genuine examples to kind of refer to. But if any of you are thinking about the EPQ, I think that could be a really good thing to do as well to kind of strengthen an application.
But final thing is basically be in interviews, just be yourself. Don't don't answer questions with something that you have been told you've got to say. If you face this question, we want sort of your kind of reasons, that kind of thing.
I think your reception is telling us to end, Alistair. It's been fine up until the last couple of minutes, but I'll stop recording. But okay, all right. Well,